Today, I'm Dr. Meenakshi, one of the mentors at StudyMEDIC, and we are yet again back with the Exam Ready series. This is going to be a quick revision for all of y'all if you're going to attend this exam. So please do watch it until the end and also drop your comments below and let us know if you've got any doubts related to this particular topic, and we'll try and clarify this. So this is going to be like a similar 2-minute with 10-minute format. But of course, I'm not going to take 2 minutes over here because I already know what the station is all about. So without wasting further time, we'll just dive into the station about what exactly this is. So today we'll be having sexual reproductive health module, out of which we have taken one task. And firstly, I would like to welcome Dr. Chitra, ma'am. Thank you so much for accepting and for coming as an examiner for my station, ma'am. Thank you for that. And I'd like to thank Dr. Soumya, who is joining as a role player today, and I will be the candidate performing the station. So we will begin with the station now. So firstly, you have to see like what are the charts which are indicated, whatever is present outside in the 2-minute time outside the cubicle, make sure that you read everything point to point. So if you can see in the first 2 minutes, let us look at what should be done in the 2 minutes. So you know that you are an SD5, and then you're going to see a woman who has undergone some tests, and she's here to discuss the reports. And there is a bit of history that is given here, so avoid repeating that history. The agenda is that you'll have to talk about her future fertility, and please read the domains on which you're being tested upon. And here you have to explain about what the results are, which means that she's not aware about what her results are. And you have to explain about the diagnosis of early ovarian aging, and also you have to talk about the fertility options as well as the long-term health considerations in terms of the early ovarian aging. So without further ado, let's get straight into the video. So I'm going to be starting, and I would be the candidate. Dr. Soumya will be my role player. So let's begin. Hello, I'm Dr. Meenakshi, one of the doctors in the clinic today. May I confirm your name and age, please?
Hi, doctor. My name is Anna Smith, and I'm 33 right now.
Okay. How would you like me to call you?
Anna is fine.
All right, Anna, I gather from your notes that you have undergone certain tests and you're here to discuss about the reports. Is that correct?
Yes, doctor.
Is there anything else that I can help you with?
No, doctor. I'm just quite concerned about what the results basically mean.
Yes, I would explain about your reports. Is there anybody else along with you, or have you come in alone?
And no, doctor. I'm by myself today.
All right. So I have confirmed the name and the NHS number on the reports, and the reports belong to you. And based on your reports, it shows that you have a condition which is called as early ovarian aging. Let me simplify that for you. Please look at this diagram. This is the womb. These are the tubes, and these are the ovaries. So every month, these ovaries, they produce the eggs, which are responsible for our periods and also for the fertility in a woman. So normally, as the age advances, in every woman, these eggs, they tend to reduce in the number as well as in the quality. But looking at your reports, it looks that the quality of the eggs remains normal, but the number of the eggs are found to be reduced as per the woman who is comparatively of your same age. This is what we call as an early ovarian aging. Am I making myself clear?
Yes, doctor. But why is it happening to me? Is it like I'm going into menopause, or what exactly is happening, and why exactly that is happening?
It's understandable, Anna, that it could be difficult news for you to take in. And I want to tell you that this is not a menopause. Menopause means it's a condition where the ovaries have completely stopped functioning. But in your case, your ovaries are still functional, which is also indicated by the fact that your periods are regular. That is what I've gathered from your notes. I want to tell you that only the number of eggs have reduced. That is why we call as early ovarian aging, whereas the strength remains to be the same and the quality of the eggs are usually well preserved in this condition.
So, doctor, can I become pregnant naturally, or is there any problem with that?
Yes, Anna, of course, in women with early ovarian aging, there is a possibility that they can plan the pregnancies, and that is possible that it can be done naturally as well. But it also depends upon other factors. It also depends upon the age, and it depends on other factors like, as you keep postponing the pregnancy, there is a possibility that with advancing age, the strength could further be reduced, and there is a chance that you could be landing into an early menopause. So if you're trying to plan a pregnancy anytime sooner, then definitely natural conception is one of the options that is available to you, and you could definitely conceive naturally. But otherwise, there are other treatment options which are available as well. Before I take you through that, is it okay that I can ask you a few questions to know more about you?
Yes, sure, doctor.
All right. So could you tell me, are you facing any problems like any hot flushes?
No, doctor, nothing that's all.
Any night sweats?
No, doctor.
Any irritability or mood changes?
No.
Okay. I know that your periods are regular. When was your last one?
I think about 10 days ago.
All right. And are your smears up to date?
Yes, doctor.
Okay, when was the last one?
I don't remember. I think it was with my annual health checkup. But
Okay,
they
but I believe it was normal, right?
yes, yes, doctor.
Okay. Any other illness that you visit your GP regularly for?
Doctor, normal cough and cold, nothing more than that.
All right. Are you allergic to any medications?
No, doctor.
Have you ever been pregnant before?
No, doctor. Actually, I'm not planning to get pregnant anytime sooner. So that's why we're looking at options because now, right now, I'm extremely scared that, I've read this word about the report and then I was searching online. So they told me a lot of things about, premature ovarian failure and all these things. So I'm quite confused about that. Like, what exactly is happening? And I do not have a partner at this point. So I am really looking forward to, getting pregnant after a few years. So is there any option that I can that will help me out in this situation?
Of course, Anna, there are different options which are available. And thank you for opening up regarding your concerns. And thank you for letting me know because that's going to change how we'll be managing you further. I will take you through that. But before that, may I ask you just a few more questions?
Yes, yes, sure, doctor.
Have you got any surgeries in your tummy or in your pelvis?
No, doctor.
Any treatment like any chemotherapy or any radiations?
No, doctor. Nothing of that sort.
Okay, anything significant that runs in your family? Anybody with early menopause?
No, no, doctor.
Okay, and certain questions related to your lifestyle. Do you smoke?
No, no,
Do you take alcohol?
no, doctor.
Drugs for fun?
No, nothing.
What do you do for a living?
Doctor, actually, I'm working in a company, so it's like a 9 to 5 job.
All right, and how well are you supported?
I'm well supported at home.
Okay, may I know your weight to height ratio?
It's 24.
Okay. Thank you so much for letting me know about all that information, Anna. So I will take you through how are we going to manage you now. Coming to your concerns about the premature ovarian insufficiency, I would like to once again clarify that this is not a premature ovarian insufficiency. When you talk about menopause and about this condition of premature ovarian insufficiency, it means that the ovaries would be stopping to function completely. Whereas in your case, your ovaries are still functional. That is why you're getting your periods regularly and you've not had any other symptoms, thankfully. And I want to tell you that, but this early ovarian aging could be leading into a premature ovarian insufficiency. And also women with this condition can also have an early menopause. That's the reason we usually recommend, if at all you have any fertility plans, we usually recommend you to plan anytime sooner. But since you've got certain concerns that you'd like to plan it in future, there is another option which we call as egg freezing. Am I clear so far?
Yes, doctor.
Okay, currently, based on the reports, it only shows that it's an early ovarian aging, which means that the potential of your eggs is good enough. So therefore, you'll be further assessed by a fertility specialist, wherein they would be checking once again. It's important that we keep tracking your hormone levels to check whether you are going into an early menopause. And as long as now the eggs are functional, so therefore, it would be better that you can go for an egg freezing. And later, whenever you plan to get pregnant, we could fuse it with the sperm of your future partner, and therefore you could get pregnant in the future as well. If you're trying to postpone this process, there is a high chance that, in women with such condition, they might require donor eggs in the future because the quality tends to get decreased as the age advances. Am I clear so far?
Yes, doctor. I just have one more concern that, doctor, why wasn't it picked up earlier? Because I'm very regular with all my tests and, health, annual health checkups and everything. So why wasn't it picked up earlier?
Well, Anna, in your case, it looks like you have got no symptoms at all. Your periods have been regular and you're not planning to have any kind of pregnancy, etc. Some women with early ovarian aging, when they plan to get conceived, there is certain difficulties they might experience in conceiving, right? You have not had any such history. So that's the reason these are the hormone tests which you usually don't do unless a woman is planning to get conceived. So that's the reason maybe this was not done earlier. Now, since you're planning to have a pregnancy in the near future, we've done these tests for us to understand whether you can postpone your pregnancy or whether you'll have to be planning it sooner.
Yeah. Is there anything I can do to improve the account or, that thing?
Well, Anna, these a condition is usually it could be genetically linked or it can be sometimes related to certain autoimmune conditions. But based on your history, sometimes we might not be even able to understand what could be the possible cause for this as well. Right. So what we usually recommend is that, you can maintain a healthy lifestyle to avoid smoking or to take alcohol and to maintain an active lifestyle. And whenever we see that you might be landing into an early menopause, in those cases, it is important that we might have to supplement with the hormones given externally, so that will help you in protecting the bone health as well as heart health. But you won't be requiring that right now, because based on your condition, doesn't seem that you will be requiring this unless we see that you're going into an early menopause. When we think that your hormones are getting reduced further, in those cases, yes, we might have to supplement you with the hormones.
Okay.
Am I clear?
Yes, doctor. Yes, doctor. Thank you so much.
Okay. Is there anything else that I can help you with?
No, no, doctor. You have cleared all my doubts. Thank you.
Okay, I will give you some leaflets. You can go through them, and you can get back to us if at all you have got any doubts. And it's very important that you also consult a fertility specialist so that you can discuss and you can formulate your plan, and we can discuss about the freezing eggs, so that you will not have any kind of problem in the future, right?
Yes, doctor. Thank you so much.
Thank you, Anna.
Almost finished in time. I think you still had only maybe 30 seconds left, not much. So good one. Yeah. And it was a kind of a tricky station, but I think you managed it very nicely. Information gathering was complete. And explanation of the condition and how to manage it was also very nice. I only think maybe you could also involve your consultant in that. You didn't involve the fertility specialist, but your consultant also, I think, could be involved. Yeah, and otherwise everything was good. Though I don't know, it is like an exam tested station, I think. So there they had given the levels of FSH, I think, also, which were a little bit in the higher normal, but still in the higher range, and they had not given AMH, I think, because if you give the diagnosis of AMH, it becomes very pretty clear. So that is why when it appeared the first time, it was very confusing for the students that how to diagnose, because FSH higher, but in the normal range, antral follicular count a little bit on the lower range. So that is why it was confusing. But good, very well done station, both of you.
Thank you, ma'am. So guys, that was about early ovarian aging. So there are different possibilities. Either you may get early ovarian aging, you can also get premature in ovarian insufficiency. There's a very fine line between these two stations, and it's very important that you must understand the difference between these two. So the information gathering always, try and understand about if she's experiencing any kind of symptoms, which are usually positive in terms of POI rather than in early ovarian aging, because in this we see that usually the quality of the oocytes is good enough. So they may try for natural pregnancy, but sometimes it can get delayed. It also depends upon other factors. You have to look into male factor. You have to assess her holistically. Look if she's got any other problems as well. So everything, the fertility is not just related to your ovaries. It could be about other factors. So that is something that you'll have to be assessing about, right? So always ask about fertility plans, whether it's POI, whether it's about early ovarian aging. Always try and understand, because when she's seeking fertility, the treatment is different. When she's postponing it, the treatment could be different. And asking about the menstrual history, medical illness is very important to rule out if there is any other diabetes, thyroid, to rule out other autoimmune conditions. Asking whether she's taken any chemotherapy as well as radiotherapy, allergies, asking about addictions like smoking, alcohol is very important. Asking whether she was ever pregnant before. If yes, then was it a natural pregnancy or did she take any treatment to conceive, is something that you'd like to ask about. And family history, of course, anything significant related to early menopause and past surgical history, especially any ovarian, pelvic surgeries, all of this needs to be taken. And of course, BMI, because all of these would be an integral part, where if it is a high BMI, you'll have to talk about the lifestyle changes. And coming to the communication, always try and be sensitive. It always depends upon how the role player is reacting to you. Okay, here the role player was very comfortable, yet she was actually shocked, but it is not to an extent where you do like a breaking bad news kind. So see her response, and based on that. Otherwise, there is no need to be always very sorrowful or to be very like, I'm sorry, I'm sorry. That's not required. It completely depends upon how the role player is responding. So you have to take the station in that direction and be honest about this condition. And then you have to always keep checking the understanding as much as possible, and giving leaflets at the end is very important. And if she's repeatedly feeling sad or if she's upset about it, then you may offer the counselors, but otherwise it is not required. And patient safety, try and explain about what this is about early ovarian aging. You need to be very clear, and you may use your own sentences of explaining the condition. Doesn't necessarily mean that you have to do it in the way that I have done. It's just an example. You could do it of your choice. And tracking this ovarian reserve, that has to be done over a period of time to understand whether she's having any kind of depletion further, right? And talking to the consultant, that is very important. Talking to the fertility specialist, you may have to do that. And talking about the egg freezing, that is important. Otherwise, sometimes early ovarian aging, people might require donor eggs as well. And don't tell any kind of unnecessary investigations, we'll do this or we'll do that. That's not required if the diagnosis is clear to you. And you have to understand the main questions that patients could put up is whether they're having in menopause or whether they won't be able to have kids. That is something that you'll have to address in a very sensitive manner. In this case, she wants to postpone her pregnancy, so that's the reason you give about egg freezing. But otherwise, you have to give about natural conception versus egg freezing, and sometimes requirement of donor eggs as well. And trying to talk about lifestyle changes is very important, because she might land into an early menopause. So that's the reason you talk about the hormone replacement therapy. So coming to the global scoring, the past movie, obviously you have to give a balanced counseling for her, and don't create any kind of panicky or anxiety to the patient. Be honest, yet you have to be sensitive, and tell what are the possibilities and how she will be able to conceive, and if not conception, then what next. And giving about always try and communicate about what the role player wants, rather than you telling about all the information. And be very, very having a structured presentation would what will help you in scoring a pass in globally, if you look at the global score. And fail would be like when you try and give certain kind of misleading advice, because the woman would be asking, will I not be able to get pregnant? And if you say yes, that's the case, then that would be putting into trouble. Giving options like adoption, fostering and all is not required. Currently talking about surrogacy and all of that would not be applicable in this case. And talking about the long-term effects, now she won't be in estrogen depletion, but later she would be landing into that, right? So you have to talk about all of this. And if you don't talk about this as well as the fertility plans, then that could be a fail criteria. And always try and understand what she wants, and you have to tailor your communication according to what she wants, and look at her emotional concerns. If she is very sad or if she's upset, acknowledge that, but otherwise just go with the flow. Anything that is in between this pass and fail would come under the borderline. Okay, so that was about early ovarian aging. I hope you found this video useful. If you've got any doubts related to the station, you can drop it down in the comments and we'll be happy to help. Until then, happy studying, and I wish you good luck.